Hello, everyone. Thank you for joining us for this installment of the Root Cause Coalition's 2018 How-To webinar series. Before we get started, I wanted to run through a few features of our webinar today. All of our attendees will be in listen-only mode for the duration of the webinar. At the end of the webinar, our panelists will be answering audience questions. If you have a question during the webinar, please type your question into the question pane on the webinar control panel located at the right side of your screen. This webinar is being recorded and will be available for viewing and download at the Root Cause Coalition website later this week. My name is Monique Brigham, and I am the Manager of Education and Programming here at the Root Cause Coalition, and I'm excited to be joined by this esteemed panel to share their experience on how to start a summer meals program at their hospital site. I want to quickly introduce our panelists today, and then we'll go ahead and get started with the webinar. First, we have Derrick Lambert. He is the Senior Manager at the No Kid Hungry Center for Best Practices. We have Debbie Petitpain, Sodexo Wellness Dietitian at the Medical University of South Carolina. Leigh Caswell, the Director of the Center for Community Health at Presbyterian Healthcare Services, and Trish, the Project Coordinator at Presbyterian Healthcare Services. I want to thank you all again for attending, and at this time, I'm going to pass it on to our presenters. Derrick, take it away.
Thank you so much, Monique. I'm really excited to be here. I want to thank you for the opportunity to be a part of today's webinar on this important topic of summer meals and opportunities to serve at hospitals. I want to also thank the Root Cause Coalition for attention to this issue and to this exciting opportunity and innovative practice that's really already happening in places all across the country. And I'm also really excited to be joining Debbie, Leigh, and Trish from Medical University of South Carolina and Presbyterian Health Services. And really, we're going to hear a lot of great work from them. They have done a wonderful job implementing these programs, documenting the different models that are already out there. And so, again, thank you so much for the opportunity to be a part of today's event. So I want to go ahead and dive right in and talk a little bit about some of what we'll cover today. But before I do that, I'd like to step back and talk a little bit about who we are with No Kid Hungry and the Center for Best Practices. No Kid Hungry is a national campaign that's working to end childhood hunger by connecting kids to the healthy food they need every day, with a special focus on summer meals, school breakfast, and after-school meals. The No Kid Hungry Center for Best Practices, we provide the tools and the resources that are needed to help elected officials and their staff, educators, and community leaders achieve success in fighting childhood hunger. We provide tools and resources, case studies, reports, webinars, and trainings. We also share expertise and provide technical assistance to organizations or agencies that are working to end hunger in their state or community. And we're also a proud member of the Root Cause Coalition. Today, some of the key items that I'm going to touch on are the need for summer meal programs when school is out. We're going to provide some basics about the Summer Food Service Program, ways to get involved, and some tools and resources for folks that would like to dive a bit deeper, continue the conversation, and consider becoming summer meal program sponsors, sites, or supporters. Also have my email and phone number there. Monique, if we're able to distribute this presentation afterward, I really hope folks will not hesitate to get in touch with me directly if they'd like assistance on any of the items that we'll discuss today. Let's dive in with the need for summer meals. It's important to understand the scale of the need that these programs address when school is out of session. Though around 22 million children from low-income families receive free or reduced price meals through federal programs during the school year, notably school breakfast and lunch, less than 4 million participate in summer meals programs that are meant to fill the gap during summer vacation. This exacerbates existing challenges with food insecurity. What's more, many of these programs that do serve meals only operate during a portion of the summer break. For example, maybe 2 or 3 weeks out of a 2-month period, or maybe 1 month out of a 2-month period. This lack of access to nutritious food has serious consequences for child health and well-being. As you can see on the slide, about 4 million out of 22, that means only about 1 in 6 children who receives meals during the school year are actually receiving them in the summer. So we know that there is a demonstrated need for these programs. And there is a program that helps fill the gap, the Summer Food Service Program. This is also known as the SFSP, and it's a Department of Agriculture program that's authorized by Congress, and it's regulated by the USDA Food and Nutrition Service, providing reimbursement for meals that are served to children in eligible communities. It's administered at the state level, by various departments such as education, human services, agriculture, and it's implemented locally by program sponsors such as schools, local or county government, nonprofit organizations, and universities or colleges. Program sponsors partner locally with one or more sites that serve as the point of service where reimbursable meals are served to children 18 and under. Federal reimbursement is provided for meals served to children under established federal eligibility criteria. As we continue the conversation today, I mentioned some of the kinds of sites that are serving, such as schools, county government, nonprofit organizations. We believe there is a great opportunity for the healthcare community to be directly involved in the service of these programs at hospitals, at healthcare community sites, WIC clinics, and others, either directly serving meals or indirectly by promoting the availability of summer meals in the community. As you can see, this is a program that funding is made available as an entitlement program. There are reimbursement for every meal that is served to an eligible child. So if the community qualifies, if there is a willing sponsor, and if the program is run in compliance with federal guidelines and with state and local health regulations, dollars are available to cover costs for these meals. To go into our next slide, I want to review some basic outlines of participant eligibility and meal service parameters. Participant eligibility is for children and teens 18 and under. Any child 18 and under who comes to an eligible site is able to receive meals based on categorical eligibility at open summer meal sites. This means there is no individual income eligibility check. Categorical community level eligibility is established based on school enrollment or census data, census block group data. This means that as a children or a family comes to the location, they're able to participate without having to provide information about where they live, about their income status, and so this makes the program accessible. This makes the program something that is truly open to the community. The meal service itself needs to satisfy a congregate meal requirement. This means that meals that are served must be consumed on site. Reimbursement is available for meals that are served to participants in eligible communities and at predetermined meal times and up to 2 meals per day. Activities are recommended but not required. Experience has shown at all kinds of sites across the country that activities alongside meals helps to boost participation and retention rates during the summer and is an established best practice. For those of you on the line today who are maybe telling yourselves, this sounds like a great idea, but how do I get involved? Well, I want to give you 4 discrete ways that your organization can consider getting involved in supporting this program, and more importantly, supporting access to healthy food for children when school is out of session. You can help drive community awareness by promoting the program. You can consider sponsoring the program, serving meals as a meal site, and/or volunteering at existing sites. So with that said, let's dive right into the 4 options. First off, everyone on today's call can promote summer meals and the availability of summer meals in the community. Healthcare institutions are trusted community partners, and your voice is an important one in helping elevate the profile of these programs in the community and making sure that families have information about when and where meals are served and feel comfortable participating in these programs. There are numerous ways to get the word out. The first and most important one is word of mouth, talking about summer meals and encouraging participation among those you serve. Number 2, within your community, any internal or even external newsletters, providing summer meals fact sheets to staff within hospital facilities. You can promote an awareness of and information about these programs within the healthcare community so that they are empowered to talk about the programs in and among those they serve and in their day-to-day lives. And then there's outreach to the general public, such as flyers and posters, yard signs, business cards, and newspapers or radio ads. Now, even if you don't know where or when meals are served, there's a great national tool available to you that you can help promote this program. Families and children, by texting food to 877-877, can receive information on up to 3 nearby meal sites in their community during the summertime. This service also operates in Spanish by texting comida to 877-877. So you don't have to know all the information about what's happening in the community. You can promote information about this hotline so that families can learn more about the program. how do you get started? Say you want to get this information out there. You want to promote the program in your community. Well, we at No Kid Hungry have developed a summer meals outreach toolkit with lots of template materials, just like the one you see on the screen. These are PDF flyers. Some of them you can modify these documents to drop in any logos from your healthcare institution or partner institutions. We have business cards. We have yard sign templates, all kinds of resources so that you don't have to start from scratch. Again, I'd like to emphasize that even if you were unable to take additional steps that we'll see shortly, anyone and everyone can promote awareness of summer meals and the texting hotline to locate summer meals beginning this summer. The second way, if you want to dive a little bit deeper, is to become a sponsor for the program. So what is a sponsor? A sponsor is a fiscal agent for the program who enters into an agreement with the administering state agency to operate the program, to serve meals to children, and to receive reimbursement for meals served. A sponsor may manage one site, or they may manage multiple sites, and this can be within your existing healthcare network, or it can also extend to community-based sites. If you'd like to get started, you can contact your state agency, and we have a link here on the PowerPoint so that you can find and locate the administering state agency that's responsible for this program. Again, in most states, it's the Department of Education, Department of Human Services, or the Department of Agriculture. At that point, you can learn more and apply to participate. I will note that some of the state and national, some of the state deadlines to apply to be a sponsor are coming up soon, but if this looks like it may be a feasible outcome for your organization to sponsor a program and there is an identified need in the community, please reach out directly to your state agency for more information, as they may be able to work with you. Additionally, note that sponsors had the option of preparing their own meals by being self-prep sponsors or contracting with a vendor to receive meals for service. The second way to get involved is to become a meal site, which is the physical location where meals are served. A site is partnered with a sponsor, who the sponsor works with the state agency, and the site serving meals works with the sponsor. In this way, sites are responsible to attend sponsor training on how to serve meals and how to run compliant programs. In most cases, they receive and serve meals that are provided by the sponsor, documenting the number of meals served on a daily basis, and ensuring compliance with federal guidelines, such as the congregate meal requirement, and making sure that all state and local health code regulations are respected. Because they are partnered with an existing sponsor, sites are generally not responsible for financial liability or most of the paperwork associated with the program, which lies with the sponsor. This is also easier to do on shorter notice. So given that here we are in early to mid-April, it may be a bit of a stretch to become a sponsor for 2018, but it's still early enough to become a site. So how do you get started to become a meal site and to serve meals at your location? Well, you want to partner with a new or existing program sponsor. Again, I would recommend reaching out to the state agency to identify who those partners may be in your community. You'll want to establish eligibility of your site location based on school, free and reduced priced enrollment, or census block group data. And again, as a best practice, you'll want to develop a plan to pair meals with activities. The final way to consider getting involved in this program is to volunteer at existing sites. Volunteers can help in a number of ways. They can help serve or transport meals from a kitchen to a meal site location. They can provide general supervision to support staff at sites as they serve meals, and you can even organize site activities, including health screenings or other activities that may already be tied in with your work within the healthcare community. How do you get started in this way? Well, you want to reach out early, up till now, beginning in January, but all the way through April or May, to match your volunteer capacity with identified sponsor or site needs. You want to match those needs with your capacity as a volunteer organization and ensure follow through for any commitment that you make, seeing that those sites have what they need and they're able to count on you as a trusted community partner. One piece of advice is to start small with something you know that you can do, a capacity you know you can fulfill as a volunteer, and to build on that commitment over time. And you do that by putting together an action plan that is realistic, that you can deliver on, and that will provide an opportunity for growth as time goes on. So the 4 ways to get involved are to promote the program, to consider becoming the sponsor of a program, to serve as a meal site, or to volunteer at an existing site. We believe that all healthcare institutions have the opportunity to invest in one or more of these opportunities to support summer meals programming beginning in 2018. To do so, we want to provide access to some summer meals tools and resources. First off, I'd encourage folks to visit our website, bestpractices.nokidhungry.org. We actually just launched our new website, and it's very easy to navigate. I want to encourage folks to register for upcoming webinars, listen to recorded webinars, and I will highlight that the recorded webinar link there will actually take you to one that we did just a couple of weeks ago on serving summer meals in healthcare institutions that will give you additional insight to support and to complement what you're going to hear today. We have those downloadable outreach materials, and we also have program basics about the program for those of you on the call who would like to learn more, or if you'd like to speak with administration or community partners to characterize the program accurately. You can sign up for our newsletter, which provides access to trainings, new resources, and partner updates on a monthly basis. And if you'd like to dive a bit deeper and learn more from the USDA, we have administrative guidance for sponsors, a site supervisor's guide, and nutrition guidance. These are official USDA resources that are available to you at no charge to be able to learn more about the program and explore opportunities to get involved. With that being said, I finished my comments for now, but you are about to hear some great examples of how hospitals and healthcare institutions have gotten involved in this work. And for that, I'm going to pass over to Debbie Petitpain from the Medical University of South Carolina. Debbie, thanks so much. It's always a pleasure to work with you. Really excited to hear about the different models to share today.
Thank you, Derrick, and hello, everyone. I would also like to say thank you to the Root Cause Coalition for having me today. I'm excited for this information to continue to spread, and the part that I want to share with you, I know you're getting a lot of information this afternoon, is really starting to think about how to take all the information Derrick shared with you about summer feeding and the different ways healthcare institutions could get involved, and actually give you some examples of how we're seeing this play out across the country. Just to reiterate, Derrick talked a little bit about the rates of hunger in America and the term food insecurity. And I think a lot of healthcare institutions recognize there might be hunger in their community, but we need to help them understand why it makes sense for them to engage and how it's personal to their operation. And one of the things that's really helpful is to explain to those organizations that the prevalence of food insecurity can also be cyclical with families, and often it's not a constant, but there can be an unfortunate circumstance that actually triggers this state for people. And one of those types of unfortunate circumstances, of course, is a hospitalization. So it's in our patients that we see within our institutions that might actually be experiencing food insecurity for the very first time. We also know that as clinicians, it's really difficult to treat people for their chronic medical conditions if they're also suffering from food insecurity, because these things go hand in hand with each other. And actually, economic estimates contribute that the lack of access to healthy food is cost the country about $160 billion a year in healthcare costs. That's a really staggering monetary figure that quickly grabs the attention of a lot of administrators. We also know that out of those who use one of the food pantries or food banks or another place out of the Feeding America network, that the Hunger Report has shown us that a lot of these clients have chronic health diseases that are related to nutrition. 70% of the households who use those services have at least one member who has high blood pressure. 47% of those households have at least one member who has diabetes. And 75% of the clients have to choose between paying for food or paying for health care. And that's personal to me, I have to say, as a mom. This idea of I can either spend the money that I have on feeding my child or taking my medication. It's a no-brainer on which of those choices that I would make. But also as a dietitian, it's really hard for me to counsel my patients on how they can use food to control their medical conditions if I know they don't actually have any of those options available to them. So this actually becomes a really critical piece to how we provide treatment to our patients. As Derrick said, the summer feeding program is just one of the different existing child nutrition programs out there that healthcare organizations can leverage, and we're starting to see this become more of the trend. And part of the point part of the reasons why summer is a really great place to start is because kids are actually at increased risk during those summer months for both malnutrition and obesity. And those are two critical conditions that a lot of healthcare organizations are already working hard to fight against. Derrick also mentioned about participation rates, and what we know is that a lot of the children who qualify for summer feeding programs don't actually participate. And the reasons for that are probably multifactorial, but one of the reasons surely is that there's not access to an appropriate site where the child is at the moment. And an example of that would be if a child is participating in a summer feeding program in their hometown, but for whatever reason is at your institution that day, then they're not able to get the free meal that they might otherwise have access to. Or maybe you're in a community where there's not very many other summer feeding sites or not very many summer feeding sites in a safe area. And as an anchor institution, healthcare facilities usually are a safe and credible place for children to seek out in order to get all types of services. Feeding them is not, really much of a stretch in that way. Derrick also mentioned all of the different ways that healthcare organizations can get involved, and I think this is both the blessing and the curse of this program. The blessing of it, of course, is that with all the flexibility, there's surely a way that you can work this program to best fit the context of your community and within the parameters of your operation. The curse, of course, is that when you've never done it before, you kind of don't have any idea where to start, and so you want to get some idea of what these different ways of operating this program would look like. And so that's what I want to share with you next. As I mentioned already, it's been very exciting to see the number of hospitals across the country that are participating in this program continue to expand. This is the current list I have. I'm sure that there are some that are left out. If you know of any, please let me know so that we can update this. But what we've noticed is that these hospital operations are starting to create a pattern and highlighting for us different ways that you can do the summer food service program in your hospital. So let me give you some of those examples now. The first one that I want to share is actually from my institution, the Medical University of South Carolina, which is in Charleston. And the model that we did is called the Offer versus Serve. We first started our program in 2015, and we have 3 different sites on our campus, 2 cafeterias and 1 small cafe out of our ambulatory care clinic. And we wanted our children to be able to come through our hotline just like all of our other customers, whether they're doctors or nurses or families that we're visiting. And so what we do is we offer all of the required servings of the different food groups, the meat, the grain, the milk, and at least 2 different vegetables. But using the offer versus serve model, the child is actually allowed to decline a certain combination of those components, which minimizes waste and, of course, also gives the child the perception of choice, which helps them improve their intake. We were able to serve just over 2,300 meals in the first year, and we doubled that in the second year. We've done about 13,000 meals in our first 3 summers. We're gearing up for summer number 4. And we've been able to document that our model allows the cafeteria to operate normally without disruption, and also that the program is financially sustainable. We were also able to use our computerized point of sale system to show what protein was the most popular with our children, and the answer is chicken, and that our mindful or our wellness item of the day was chosen at least 30% of the time. Most of the time the children selected milk, and they pretty much always got a vegetable, if not 2. Just to give you a little bit more of a visual of what this looks like, we wanted our children to be able to kind of self-direct themselves through the flow of the cafeteria, and we didn't have any dedicated FTEs to help us with this program. So we created this cute little friendly purple octopus, which was the mascot that sort of guided the child through the cafeteria so they knew where to go. So the octopus with some information about the program would greet the customer at the front door. The top center picture is a trifold that explains to the family how they can pick and choose certain combinations of foods from each food group. And as you can see on our line, we have a wide selection of choices of different types and different beautiful colors that are available every day. Our line server would then help the child make sure that they're selecting the right combination of food, and then they would go to the registers to check out and then sit in our dining area to eat the food. Another model that's similar to ours is run by ProMedica out of Toledo, Ohio, and they also provide hot food to the child, but they do it in a made-to-order fashion out of their grill station. So the child actually goes up to the grill. There's a menu there that highlights what the Kids Eat Free meal of the day is, and then the family can say, we'd like one of those, and it's made right then and there for the child. They were really successful in serving a lot of meals within the first 8 weeks in their very first year. They have expanded the program to include one of their community hospitals in Fostoria. And what's interesting about that program is not that that particular hospital feeds a lot of kids, but it's a great example of how it offers another choice to the kids in a community when there really weren't very many other places to go. So when you're thinking about the outcomes that you want to measure, try not to get too hung up on just the number of meals served. Really thinking too about, are we closing a gap that exists just by offering an option? Another example, this speaks a little bit to how Derrick was explaining some of the options. If the hospital doesn't want to be a sponsor, or in this case with the Carolinas Healthcare System in Charlotte, they missed the deadline to apply to be a sponsor, the option then is for the hospital to be the site only. So when this healthcare building or cafeteria site wanted to come online, as I mentioned, they were too late to apply to be a sponsor, so the state agency actually helped recruit a sponsor for them, which was Freedom Within Walls. And then the cafeteria was the site only. They also provided hot meals doing the offer versus serve program for breakfast and lunch Monday through Friday. And what was interesting is that it would have been really easy for this hospital to say, you know what, we missed the deadline. We wanted to be a sponsor. There's only a little bit of time in summer left. Let's just wait until next year. But instead, they persevered and they went ahead and went live and were able to grab the last few weeks of the summer. They served 154 meals in those last 3 weeks. But what it did was give them the experience of operating the program so that they were then able to use those lessons learned and plan out throughout the rest of the fall and early spring into how they want to expand their summer feeding program for this year. Monique, can you advance my slide for me, please? I think I'm having a little trouble with that.
Yeah.
Thanks.
It's just taking a little bit of time.
Yeah, I'm not known for being patient, so I have another example for you guys, and this is from University Hospitals out of Cleveland, Ohio. They have done a couple things that I think are really fun and unique to highlight. One of the first is that they actually partnered with their Injury Prevention Center out of their children's hospital. And so this is the group that really promotes things like bike helmets and car safety. They have a direct connection to the child population, and it was the Injury Prevention group that was actually able to man a table in the cafeteria every lunch for the summer feeding program, which also gave them access to the families to be able to provide them with some of the information about the services they offer or some of the risks that they wanted families to be aware of, like I said, bike helmets or even pool safety, things like that. Another thing that would happen when they stopped at that table is they would actually get a voucher, and the Care Bear is the hospital's mascot, so they were able to weave that into this voucher as a recognizable mascot. And then the child would go through the hotline in the cafeteria and then go to the cashier system, and they would ring it up through that computerized system, and the child would hand the cashier the voucher, and that was part of how they kept their meal count. And we've seen other hospitals that successfully have replicated this, where there are institutions where they want to actually use the ticket to help to kind of track things or to incentivize children to make certain stops. So, for example, they would get the ticket for the free meal if they stopped at the registration desk to make a follow-up appointment or to check out, for example. So far, what I've shown you are hot meal examples, whether it's offer versus serve, made to order, etc. But really one of the classic examples when we think about a summer feeding program is the bagged lunch, or what we call the unitized meal. And this is where when all of the required components of the meal are in one bag or one unit, so that you are not worried at all about whether or not the child is making the right combination of foods for it to be considered reimbursable. You're just providing them with everything. And really the classic facility that's been doing this for a long time and providing us with some great outcomes is Arkansas Children's Hospital in Little Rock. And they actually have a volunteer line that lines up to make all of their lunches, and then they're bagged up and put in a cooler that the patients and the families are able to access when they come in through the main entrance. We also here at MUSC piloted a similar model in our very first summer, where we actually had an oncology clinic where the children were too immunocompromised to actually recommend to them that they go down to the cafeteria. So instead, we delivered bagged meals up to that nursing unit, and then the nurses were the ones who were actually in charge of distributing the meals, keeping the meal counts, etc. And then the last example that I want to share with you, because I just think this is so fun, is using a non-traditional vendor. So Derrick mentioned that you can either be a self-prep site where you make the food yourself, or you can work with a vendor. And for a lot of hospitals, this might even be the food service management company that already exists in your operation, whether it's Sodexo or one of the other large companies. Our Lady of the Lake in Baton Rouge was a self-prep site, and their cafeteria was making their lunches the first couple years that they did summer feeding. And then in 2017, right before they were getting ready to operationalize, there were some changes that happened internally that made it too difficult for the cafeteria to provide the meals. And so the hospital was trying to figure out what they could do in order to have bagged meals ready to go for the kids. And so they actually worked with their local Subway franchise, and they contracted with them to be the vendor, and Subway would make X many meals in the morning at the price that they had agreed upon with the hospital, and then one of the hospital volunteers would go pick it up in a cooler and bring it to the hospital, where the sandwiches were kept in a refrigerator behind the security desk. And when the children checked out of their clinic appointment, they got a ticket that they were then able to bring downstairs and hand to the security guard, who gave them their meal, and they had tables and chairs set up in the lobby. And they did both breakfast and lunch, and they did almost 3,000 meals last summer. And I think that there's an opportunity when thinking outside of the box in this vendor situation on how you can use these corporations with a lot of brand recognition and marketing capacity to really help you launch your program into your community and give it some of the visibility that you might want it to have. Sorry, this is actually my last example, which is a lot of times when I talk to healthcare organizations, they're very overwhelmed at the idea of driving more children into their retail spaces. Most cafeterias are already too small for the hospitals in which they sit. They're very full and busy, full of normal clinicians, faculty, staff, students, families, visitors, and this idea of driving a lot more traffic in there can be overwhelming. And so there are, of course, all types of rules around food safety and monitoring food distribution, meal counts, all of those types of things. But you don't actually have to use a dining area as a place for the children to eat. So an example of how we've seen this is we have a half-acre urban farm in the middle of our campus, and we actually did a bagged meal program out of the urban farm on weekends one summer. We've also seen a hospital in Florida that had a floor in one of their hospitals that was where their Ronald McDonald House was. And they were really trying to serve the siblings of the children that were inpatient. And so they had the little play area on that floor of the Ronald McDonald House. And then we've seen other examples where there might be a spare classroom or just a separate wing down a hallway where kids who want to specifically participate in this program can go to that location, and you can kind of move your traffic around. You can also, just as we talked about already, the flexibility of the program allows you to decide what days of the week and what times of the day you're offering your meal program. So if you need to pick a non-peak hour to serve the children so that you're not trying to serve them at the same time your cafeteria is super busy, that's an option that you have as well. So again, these are just some different models that we've been able to see be successful in the country that we like to put out there as examples of what it might look like in the institution that you're considering. Some of these examples and some other how-to steps are in this implementation guide, which sits on our website. And I know that No Kid Hungry and others have also pointed people to this. I would also just point you to my contact information if anybody wants to talk one-on-one about what something might look at their institution. I'd be happy to do that. So next, you're up for a real treat. You're going to get to take a deeper dive into a specific healthcare institution, Presbyterian. And so I'm going to pass the controls over now to Trish and Leigh.
Thank you, Debbie. See. Okay, great. Thank you so much. My name is Leigh Caswell, and I'm the director of the Center for Community Health at Presbyterian, here with Trish Moore, a project coordinator on our team. And we're really excited to share with you our journey. For a little bit of context, Presbyterian Healthcare Services is an integrated health system in New Mexico, and we are just located in New Mexico. We have 8 hospitals in 7 different communities, although we're opening a new medical center this year. We have a tertiary care facility and 2 community hospitals and 3 critical access hospitals. So we're in very urban settings and also rural settings. And we serve 1 in 3 patients in the state. And we're a nonprofit health system. So a lot of this work is really related to our purpose of improving the health of the patients, members, and communities we serve. And a little more context about New Mexico: 1 in 4 children in New Mexico are food insecure, or 28%. 71% are eligible for a free or reduced price lunch, compared to 52% in the United States. 29% of children are in poverty, living at 100% or below of poverty in New Mexico, and 20% of everyone, compared to 15% in the United States. And in New Mexico, the summer feeding program is administered through our state Children, Youth, and Families Department. So a major focus of the Center for Community Health is the Affordable Care Act requirements of completing community health assessments and plans. And so we have done this for the last 5 years. And healthy eating, active living, and prevention of unhealthy substance use have been consistent across the entire state as our priorities. And so this really falls under our healthy eating priority. And we're really looking at a comprehensive strategy at the community level, organizational level, and individual level. And this summer meals program and the at-risk program address both access and nutrition education. So it's a really high yield intervention for us. Here you can see a picture of our flyers that we've developed. So I know this webinar is about the summer meals program, but we offer the summer meals program and the at-risk program. So there's, as close to possible, a seamless transition between the 2 throughout the year. So these free meals are offered all year round whenever the cafeteria is open at the individual hospital. Some of them open 7 days a week, as you can see on this flyer, and some just 6 days a week or less. Mm-hmm. And sometimes the cafeterias are open from 1 to 7. So as you can see, somebody could access a meal between 1 and 7, or at some other hospitals, it could be just for a 2 or 3 hour time period. So it's a really great way to leverage our existing infrastructure. And 5 of our 8 hospitals offer the program, and 2 of them are, we have not been able to prove that they're eligible. And the third one is offering a similar program on their own, just to a certain, in that community, and just paying for it themselves. But we have provided almost 20,000 meals over the last 2 years since we've been offering the program. So we're really, really proud of that. And again, since this is focused on the summer meals program, these are our hospitals that have participated, and these are our 2017 numbers. And you can see that there's a wide variation in the number of meals served at each. The Plains Regional Medical Center is in a rural community in our state, but they have such strong relationships with the community and have done a great job of getting the word out that you can see last summer they fed over 4,000 meals, and Lincoln County Medical Center wasn't participating last year, but they have been approved for the summer program this year. And then you have like our Caswell Hospital just started last summer and has had more of a challenge getting the word out about the program. So they provided fewer meals last year. Now I'm going to pass it off to Trish, and she can share with you some of the more details about the program.
So hello, everyone. So for the last 2 years, I've been managing multiple sites. The main hospital is our sponsoring location as well as a site, and then the other participating hospitals are considered sites, so we all fall under one sponsoring agent. We started with 3 hospitals in February of 2016, and then have been able to add the Lincoln County Medical Center just this last fall, and Caswell the last summer. So we're now at 5. And one of the main things I would recommend is that you start early for your application. As Derrick had mentioned earlier in the presentation, the sooner that you get your application requirements gathered up, the better you are for meeting that deadline for applying for the participation in the program. Our children also come into the hospital, and it's offer versus serve. So they go through the hotline, and they have a specific amount of components and things that they are allowed to eat based on the menus that are submitted for application. All the menus have to be approved by the program before you can serve. They have to have certain ounces of meats, and they all have to be pre-approved before you can serve anything. And as stated earlier in the presentation, the surrounding school districts are how we qualify for whether or not we can have the program or not. You have to keep track of your per plate costs. Yearly training is required for each coordinator. So you come and you have your training, and then those specific site coordinators go back to that hospital and train their staff. It's very important to keep documentation of all that training so that when you come to the time when you might be audited, you have all that information ready to prove that your staff is providing the program as required by the state. We do the nutrition education handouts from My Plate. You can get them online. They're for free. I know the summer program does not require it, but the at-risk program does, and that's one of the things that we try to provide all year, so it's more, as Leigh was saying, a seamless transition. So there's no confusion as, oh, we have to provide the games this time in the fall, but not in the summer. So we just do it all year. One thing to remember would be the time spent facilitating the program is not reimbursed. So my time, the time of the hospital staff, the time to submit and collect all the information for the application, that is not covered. A lot of times the promotional materials are not covered. Basically, it's your food. Renewal submission is required yearly. So again, you need to go to the training and get your forms in on time to continue the process. So we talked, Derrick was talking earlier about promoting the program, and I really like that Summer Meals Outreach Toolkit. I'm definitely going to go check that out and see what you all have put together. We again have come up with flyers and posters. We provide them electronically to the Albuquerque Public School System so they can print them out or promote them within their PTAs or PTOs and newsletters that they send out to families. We've provided flyers in the Department of Health backpack program. We put the flyers in the emergency departments at our hospitals and around local pediatric offices, daycares, churches in the communities around each hospital, so people have a way of knowing what's going on. We have found that some of the internal employees at Presbyterian don't know about the program, so that's one obstacle we're overcoming, is letting people know internally that the program is there. Each hospital was provided with a pull-up poster and signs to put in their entrance of their cafeterias, and you are required through CYFD to have a radio announcement and newspaper promotion. The voucher you see at the bottom was developed, it's not required for a meal, but it was developed to hand out at tabling events, put in backpacks, and it's just a way to make the child or family feel more comfortable coming to the cafeteria to get their meal. It's not required to serve the meal, but it just kind of helps them make them feel more comfortable when they come to get it. I think part of our successes and what we have found that identifying champions within the food service team is a great way to promote it, as long as people know, the employees know why you're doing it's for the kids. So don't get caught up in all the paperwork and the training and having to keep records and monitoring. The main thing is, remember, you're feeding the kids. And obviously across the country from the demonstration today, there are a lot of kids that need food. And so if you keep the big picture in mind, that just keeps you on the right track. But it is important to plan your menus and recognize the employees that are out there, boots on the ground working, because they're not getting paid extra to do this. They're doing this out of the goodness of their heart. We were able last year to provide certificates of appreciation and gas cards. We also have a employee recognition program within Presbyterian, and so we listed all their names and thanked them publicly for all their help. Administration buy-in. So for success, we have identified some keys to success to the program and why it matters in the community as the main reason. But we think administration buy-in, because they will have to sign off on the forms when you apply, recognizing the staff, as we've said, allowing time for administrative overhead, so paper and printing, my time, the staff's time. You just have to have time to do that. Somebody dedicated to coordinating the program, your frontline champion. At our Press Main Hospital, the food service coordinator there is my champion. She's the one that knows about planning menus and what the component requirements are. So she helps me communicate with the other hospitals, especially when they're new and coming on board, and kind of calms their fears about all the paperwork that's required. So she helps them with planning their menus and getting the paperwork done. And then again, we all want to reconnect to the purpose of Presbyterian, of healthy eating, active living, and avoiding unhealthy substances. I would recommend keeping meticulous records. We have been audited for the summer program as well as our at-risk program.
Well, thank you so much for giving us the time to share with you, and we look forward to answering any questions. Again, feel free to reach out to Trish or myself if you have any questions as well that you don't get answered today. And thank you to the Root Cause Coalition for creating the space to talk about this important program.
Yeah, thank you.
Great. Well, thank you to all of our panelists for sharing their stories and experience on this webinar. If you have any questions, I'll give everybody a second to type them into the questions pane on the right side of your screen. And our first question comes from Grace, and Grace asks, for sponsors, what is the reimbursement rate percentage of summer service programs?
This is Derrick. I think I can take that. Monique, I can send around. They actually have the updated numbers for this year. And Debbie, you may know a little bit. Is it $3.93 for a lunch this year?
So I haven't looked up this year, but that sounds about right based on last year.
Yeah, I think
$3.55 for us.
Something like that.
Yeah. It's a difference, and just to give folks a little bit of additional context, and Monique, I can send the actual numbers to send as a follow-up. But there is a differential between whether you're serving the meal you're serving. So the highest reimbursement, which is between $3.50 and $4, is for lunch and supper. So those are two meal options that are reimbursed at the same amount for the same amount of food. Lunch and supper, in terms of the components, are not different at all. Breakfast, so lunch has 5 meal components, and then breakfast has 3 meal components, and it is reimbursed at about 65% of the lunch rate. And then snack only has 2 components, and it's reimbursed at the smallest amount. So there is a difference between the different meal options you have. There are different component requirements, and the reimbursement reflects that as well. But Monique, I'm happy to send around the updated specifics to send as a follow-up.
That would be great. Thank you, Derrick. Just a reminder, if you have any questions, to type them into the questions pane. Laurel asks, she's part of a hospital that is a summer meal site and has been providing lunches for other program sites for many years, she says, and she indicated one of the struggles is that the paperwork is just a little too much. So I wonder to our panelists, how can we simplify the paperwork and what steps can we do to move that forward to make it easier for sites?
Want me to answer that? This is Trish. I will answer that. I would say the first year, the paperwork is daunting and a bit overwhelming. I think the more times that you complete the paperwork, it is easier. And I would recommend talking to someone who's already been running the program, and maybe they could help guide you to how to fill it out. I'm more than happy to help you if you want to call me.
Thank you.
This is Debbie. I just want to add to that I think we all agree, and I have heard, and Derrick might be able to speak to this a little bit more, that USDA is trying to look at how maybe to make this easier, but I think it's important to continuously provide that feedback to your state agency, because as Trish was saying earlier, we all want the same thing, which is to connect the children with these services, and that's a great thing. And my experience is that the state agency, the USDA, they're just not used to working with institutions like us. We speak different languages. We're coming at it from sort of different perspectives. We want to accomplish the same thing, but sometimes figuring out how to find a mutually acceptable solution is really where we end up getting stuck. And I think the more feedback that we can continue to provide state agencies and then the USDA about what our roadblocks are, what our hiccups are, how could this become easier so that more healthcare institutions follow suit, that'll help us kind of create that tipping point. I mean, you're really still looking at a relatively small number of institutions that are participating, and I think the one thread that you find is the same between them all is there's somebody in each one that's incredibly tenacious and is willing to just kind of put their nose down and figure out how to get all that stuff done. But from a organizational perspective, they already have a lot of other priorities, and it's hard to say, look, you should put your significant resources of time and energy toward this piece. That's a hard sell to do. And so I think that it's okay for us to voice our frustrations with the process if we actually want it to change to become easier.
Yeah, I would echo what Trish and Debbie said. This is Derrick. One just kind of logistical piece that I would suggest for folks that are, encountering issues with administration or are concerned about potential issues with administration is, as you have different sites that come online, making sure that you have an identified point of contact who's responsible for that service at that location can be really helpful for any communication between site and sponsor. I think it's important to have an identified, clear point of contact. At the same time, it's also good to make sure you have more than one person who's been trained to manage a site because of in-service days or family or medical leave, that individual that you have as point may not be able to be there every day. It's good to have multiple staff members who have the capacity and the knowledge about the program to manage a site. So that's a logistical piece to keep in mind as well.
Thank you. And we have another question from Rosanna. And Rosanna works at a system where they contract out their cafeterias, so they're having a hard time implementing any type of food program at their hospitals. So have any of you run into this issue? And if you have, what have you done to get buy-in from those stakeholders?
This is Debbie. I can take that one. I actually work for a food service management company. I work for Sodexo. We've been at MUSC for about 35 years, and we were actually the ones that said, hey, listen, we feed people. It's what we do every day. Let's figure out how to make this happen here. But I've heard that situation in a lot of other institutions where the hospital wants to do it. They've contracted out the food service department, and obviously at the end of the day, those are those boots on the ground that Trish was referring to, and they have to be on board. Each situation is going to be very individualized, which is not a black and white answer, and I'm sorry about that, but it's almost always tied to how the contract is set up and how the financial incentives are set up in that contract. So there are some contracts where the institution and the food service management company have agreed on an exchange of funds for X many dollars based on these services, 1, 2, 3, and that's it. And if you want us to add on any other services, you're going to have to change the contract and pay us more. If that's sort of the setup, then it really comes down to the hospital sitting down and saying, what are we willing to change in the contract to financially incentivize the company to take on basically this added work. There are other contracts where they're a little bit more holistic. Maybe the food service company is given X amount of money to basically run an operation, and if you can position this as just being what they do every single day, and it's not going to be kind of an add-on to work, it's not going to cost them more food or FTEs, it can be a little bit of an easier sell if you can work directly with one of the managers that's in the actual space, the person who's really going to have to make sure that the program runs well, if you can find one of those internal champions. And then the last place that you could actually look at too is your registered dietitian. So your RDs in the hospital, they can connect, obviously, food is medicine and how the benefit of this works. A lot of dietitians also understand the food service operation and or may even work for that company and can possibly be a bridge. The pattern that I have found in different institutions is that there does need to be a champion, but who that champion is sits in a different piece of the organization in every single example. So it doesn't necessarily matter what department they come out of, as long as they can sort of help articulate and operationalize the program. And I'm happy to talk to you offline a little bit more about that too.
Great, thank you. And if anyone else has any questions, if you want to type them into the questions pane, just a reminder to our participants that a recording of this webinar as well as the slide decks will be available on the Root Cause Coalition website. And I will be sending out an email to all of the attendees letting you all know that it has been uploaded to the website, as well as sending around the information that Derrick talked about earlier in this webinar. So if anyone else has any questions, I'll give it another few moments to type those in. Great. Well, if you have any other questions, I encourage you all to reach out to us here at the Root Cause Coalition or directly to our panelists. I want to extend a thank you to our panelists for joining us on this webinar, and thank all of our participants for tuning in. Thank you so much, and I hope you all have a wonderful rest of your day.
Thank you.
Thank you.